Hello, my name is Morgan. I did my persuasive speech on being pro choice for abortion. So, abortion is a termination of an unwanted pregnancy by removal of a fetus or embryo. An abortion without intervention is commonly known as just a miscarriage or spontaneous abortion. These actually occur within 30 to 40% of all pregnancies. And a medical abortion is a procedure or medication given to the patient to end an unwanted pregnancy. So, reasons to get one or not get one, really, it's just per choice, and there's many reasons why. Um, Unwanted pregnancy, there's rape and molestation. I think of that as a non-family member. There's incest, which is family member, and then medical emergencies. So for unwanted pregnancy, I decided to say that a lot of people are young and dumb and foolish, and they're not ready to have a family, or they don't have support to have one. The next one is rape or molestation. Not wanting to go through a pregnancy with rape or an incest baby because it is a family member. They can also have difficulties with genetic disorders or birth defects. Some people go through 9 months and then they give up the baby up for adoption, which is cool. And then incest is, although it's illegal, or I'm sorry, although it's legal in Ohio, it can cause medical concerns to the baby and the mother, like birth defects. And then it can cause distrust in people, including family members, and it can cause them to have PTSD. And they don't want to trust anyone, or when they want to find someone to have a family with or whatever, or a relationship with, it's hard for them to trust anyone because of their past and what happened. The next one is medical emergencies. There are so many medical emergencies that can happen. It can be an ectopic pregnancy where it's in the where the embryo or baby fetus is in the fallopian tube and there's a very small chance of it living. There's severe preeclampsia. I had this with both my pregnancies. My blood pressure was way, 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 way too high for me and the baby. Your feet swell. I mean, you can lose consciousness. You can get dizzy. A lot of that can be a reason to not want to continue a pregnancy. Also, there's placenta previa. That is where the placenta is attached to your uterine wall and it comes off. It like starts to peel off a little bit, kind of like a sticker. And that does not give sufficient blood flow and oxygen to the baby, therefore causing some birth defects. Hypertension. If you have hypertension in your family or you're known to have hypertension, this can actually be a good medical reason. It goes hand in hand with severe preeclampsia, but this is where you need to watch your blood pressure. If it goes too high or if it goes too low, that can be a very big issue with you and the baby. And then kidney disease. Kidneys filter everything out. Everything you ingest, I mean everything. So that would be a really good reason to also have that, especially if it's in your family and it runs genetically. So then here's some pros and cons that I have came up with being pro-choice. So pro-choice, there's pros. There are women supporting rights to choose from what to do with your body and what grows inside you. That's completely women's rights. My body, my choice kind of thing. I think I should be able to do what I want since it's my body. The other one is to advocate for safe and legal abortions and protecting women's health. This will reduce the risk of complications from a backyard abortion clinic or an unsafe abortion. These happen a lot, and a lot of people don't realize that, and a lot of people die, mothers and the babies, obviously. And then the other pro choice I found was social factors. Access to abortion is critical for women's equality and empowerment. We want to be equal. We want to be able to choose what we need to do for that's best for us and the body and the baby. And some cons that some people would say are moral and religious reasons. It is life begins at conception, and it is wrong to terminate pregnancy at any week's length that includes anything: rape, incest, unwanted pregnancy, a teenage mom. I mean, even if you have medical conditions, this moral and religious reason, people think that you shouldn't get one no matter what. And then another one is the fetal rights. Some argue that once a heartbeat is found, then the baby has the right to live, regardless of what the mother thinks or her circumstances or her health. And another con is the psychological impact after having an abortion: depression, anxiety, regret. A lot of that people go through. It puts a toll on your body. Your hormones are everywhere. I mean, you don't really know what's up or down at that point. And then my conclusion is everyone's entitled to their own opinion about abortion, but I feel like being pro-choice gives women who are going through these types of situations have more options and support making tough decisions. This is very tough, and a lot of times you need a support system, whether they support you doing it or don't support you doing it, but are there for your health. That's very important to have, and there's more to abortion than just I want to get rid of the baby. There could be way more reasons than what I even just put down. Thank you.